Hi class, my name is Chris Ibera. I'll be doing a presentation on Capstone today on my interview with Julie Gibb at Cherry Health. Cherry Health is established in 1988. It's Michigan's largest federally qualified health center providing primary care. FQHC means 90% of its budget is federally financed. It's in 6 counties with 800 professional healthcare workers in 20 locations and operates on a $70 million budget. The mission statement for Cherry Health is that Cherry Health will improve the health and wellness of individuals by providing comprehensive primary and behavioral health care while encouraging access to those who are underserved. The vision statement is our community will be healthier because we seek out and welcome those who need our services. All will be treated as family with integrated, coordinated care to improve health and personal well-being. This is a leadership structure of the chiefs. Tasha Blackman is the chief CEO. Bill Jura with the chief operating officer. Dr. Elizabeth Warner is the chief medical officer. Bob Smith is the chief behavioral health officer. Demetrius Pittman is the chief people officer. Galinda Williams is the chief information officer. And Cynthia Duncanson is the chief financial officer. Julie reports to these individuals in her role as Director of Operations. She's been at the Director of Operations for the last 2 years. Prior to that, she served 1 year as the Director of Nursing, with 7 years as a nursing supervisor. She reports directly to Bill, the COO, and Dr. Warner, the CMO. She has 10 medical practice managers reporting to her. The role and responsibilities mostly consist of implementation of new organizational initiatives, problem solving, which is remove any barriers, growth oversight of clinical teams and programs, and metrics and quality oversight. Julie's highlights are direct access to Boots, which is all the clinical teams that allows for feedback of implementation and day-to-day workflow processes. With her 12 years of tenure and rich reservoir of experience, she not only blusters new ideas but also shares lessons learned, instilling confidence in the collective journey and motivating the clinical staff to excellence. She seeks feedback from her managers and delegates projects to keep them engaged. Her drive for high employee engagement scores shows gratitude to the clinical teams, and her compassion for the community is noticed in her agenda and speaks to the mission statement. Monthly meetings with managers are utilized to strategize on how to make the organization functional. Julie and I spoke of the SWOT analysis of Cherry Health. This aligns with her and senior leadership's goals, which are remain vigilant with growth decisions on the ideal patient for Cherry Health organization, upgrade technology to better serve the patient population, and recruit new medical professionals utilizing the debt removal program through the feds. Also, know the competition. As you can see here in SWOT analysis, Cherry Health strengths are a strong tenure and medical leadership team and the exercising of patients in medical decision or corporate decision making. A weakness, though, is poor technology, which causes delays in growth and sometimes a COO alignment. Where the opportunities lie is updating technology will allow growth, better promoting the federal loan forgiveness plan, attracts new talent, and the threats are competing FHQC entities absorbing Cherry Health patients. With inflation is leading to cause for clinician turnover since FHQC pays about 30% less than your fee-for-service private entities like Corewell Health and Trinity Health. With the SWOT analysis comes the NextGen recommendations. NextGen is their EMR system that captures all of their visits, but also produces billing and coding and financial reimbursement. Currently, Cherry Health is funding enhancements to replace NextGen or better utilize it. Each service line will have a super user. They will train others on updates and newer options to increase billing and coding of visits and move patient data faster. Funding to modify the self-scheduling features via the new patient portal will allow for 24/7 scheduling by patients to increase productivity with fuller schedules for clinicians. Updating the Microsoft Azure cloud system will allow NextGen to run more robust with less crashing than the current Citrix system. SWOT analysis of the Citrix Virtual Desktop. This is something that's critical that is affecting productivity for 800 users. The strength in this is it's tailored to user rates, supports a wide variety range of applications, and allows remote usage. The weakness, though, is lots of downtime issues, limited users on the network with high latency, so over 50 people, the system gets a little bit sluggish. The driver instability is known for a lot of peripherals for not even being able to plug in, so like your USB adapter on webcams or something of that nature. A threat is there's a limited number of users on the network and high latency. Opportunities would replace servers and hardware to reduce overhead of managing system. Update to the Microsoft Azure system. So again, a new virtual system would allow for more users to have a better high definition experience and allow higher productivity and lower IT costs. The SWOT analysis again is one machine will allow 12 users in the cloud, tripling capacity overnight, upgrading a 10-year-old server and private internet to support Azure, and it supports a faster growing organization. SWOT analysis of Excel is that Excel, of course, is your spreadsheet program from Microsoft. It's a component of the Office product. It's easily available to any user to calculate data, in this case, financial data and assets are being controlled in a Microsoft application. Again, it's $70 million at Cherry Health. The strength is it's cost effective. It's basically a basic user fee to run Excel program. The sophisticated programming and scripting capabilities do exist. It's a self-paced learning process for the application. Unfortunately, the weakness is it's prone to corruption. It runs slow as the program expands and more data to review. It's very easy to make mistakes. The opportunities are to tie in accounting software for greater capability. The threat is there's no analytics, no forecasting, no reports, and no KPIs. Excel recommendations are they are moving to a Sage Financial accounting software. Excel data will be inputted as a baseline in some areas of the software. Starting over with new accounting features that track trends in billing of services and real-time control over accounts receivable and yearly spend. The managing concepts that Julie and I talked about in our interview were the RBV, the resource-based view, POR's 5 forces model, strategic leadership, and business level strategy. So for resource-based view, that's a foundational concept of strategic management focusing on firms' internal resources and capabilities as a primary source of competitive advantage. So for Cherry Health, Julie's explanation is that they have a sustainable competitive advantage by processing valuable and rare and not resources by simply using FQHC programs to go out to lower impoverished patients in the community and yield in higher services. So attracting people that have no insurance or very, very basic insurance to get the full service lines of behavioral health and primary care that they need using very little resources, such as lower paid clinicians and federally granted programs to cover the costs of supplies and doing business. POR's 5 forces model is a framework used to analyze the competitive environment of the industry. It's developed by Michael Porter. This model identifies 5 forces that determine the intensity of competition and profitability within the industry. The 5 forces include a threat of new entrants, bargaining power of suppliers, and a bargaining power of buyers, and a threat of substitute products and services. Cherry has to be very aware of this program because essentially what happens is Smaller entities are now becoming larger because the amount of applicants that are receiving no insurance or are below the impoverished line are actually increasing at a rapid growth in the state of Michigan. So other entities are finding like-minded grant products to entice these members to come aboard their different care models, where it's virtual care or more sustainable care with them going to the homes of these patients or providing better transportation resources than what Cherry Health is currently doing. Strategic leadership is a great example of what applies to Cherry Health. It's the ability of a firm's top management to set a vision, inspire, and guide an organization towards long-term goals. This concept emphasizes on the importance of leadership in shaping the company's strategic direction. Influential strategic leaders define the organization's mission and vision to create a culture that aligns with its strategic goals. So we mentioned earlier that the COO can be a threat, and that's just because there's very little background in a clinical model that he came from. So he's learning clinical model and trying to apply it to business strategy model in a concept where you have very low margins and very, very low reimbursement. And so sometimes that clashes with the clinical setting of wanting to provide whole body, mind, soul care to the patients that walk through the doors, whether it's behavioral health services, dental services, or primary care services. So alignment is sometimes off, but Julie's responsibility is go back to the strategic leadership model concept and remind him of mission and vision statements so they can keep moving forward with long-term goals being met. The business level strategy that was applied in the Cherry Health interview with Julie is that it refers to Cherry Health's actions and approaches to compete effectively in a particular market or industry. Again, this business level strategy aims to establish a competitive position that allows the firm to outperform its rivals. For the last 30 years, Cherry Health has been the largest FQHC. That was by design of coming up with concepts that were current in the moment to solve for very large gaps in behavioral health care for people that don't have insurance, but also forward thinking to figure out during periods of pandemic or little or no transportation how behavioral care health would be able to be applied to a younger generation of people attending schools or work-related programs, or even if they were an inmate in a prison within Michigan and needed access to this care. This is something that Cherry Health accelerates because they're coming up with common themes to solve for the current state of crisis, but also long-term thought process. And where Julie comes in line is that she simply meets with the CEO, the CMO, and other department heads to figure out if they are aligned for long-term goals of primary care and behavioral health, or if they need to strategize into what's trending for the next 5 to 6 years. In conclusion, I just shared a quote. Today's data is being created on a scale far beyond a human's ability to process. Future business leaders must be able to collect, analyze, and evaluate massive amounts of data daily to remain competitive. In my overall assessment of this program, I was very thankful to have multiple professors and instructors give me different points of views on how to apply an organizational leadership provision and process to my daily workload at a startup company I've been at for the last year. Prior to that, 10 years of healthcare management. Some of the situations were totally applicable, other situations were hypotheticals, but what I did appreciate is the daily challenge to apply something new, but also bring something to the table that I experienced and read about in a textbook. Also to see the culture and times change, but the concepts still remain the same. The approaches be a little bit different from my colleagues in this class, but also the ability to share feedback and ideas is super helpful in a lot of these forums. My hope is that Cornerstone continues to thrive in the market of college no longer being thought as a necessity, but as an accessory. Thanks again. My name is Chris.